For those of you who don't know Digital Square, we work with innovators, governments, and donors to support digital health programs by supporting adaptable, interoperable tools that are designed to work together seamlessly. One of the ways we do that is we support the global goods community through webinars like this. Just a few quick notes for this webinar. We ask that you keep yourself muted during the webinar unless you're asking a question. We have a Google Doc that I'm pasting in the chat right now. If we're chatting and we're worried that we're not going to get to your question, go ahead and throw it in there. We'll try and triage and make sure we get to as many questions as possible. It also has a listing of all of our previous recorded webinars in case you are interested in going back and watching anything, and solicit some ideas for additional webinars if you have some thoughts. And then again, this is a relatively small group. This is meant to be a pretty informal chat. So when you have a question, please raise your hand and we will call on you as those hands go up. And lastly, I think I'll just go ahead and introduce our speaker in just a second. But really quickly, let me introduce Jose. He is a data management standards and interoperability consultant who's worked in this sector for over 20 years. He developed Orbis and IPACS BI healthcare products and has been working with FHIR since 2009. He's been contributing to standards like HL7, HIE, and ISO as well, and facilitated the launch of HL7 and IHE work groups in Brazil, Portugal, and Belgium. And he is also a resident expert on all things FHIR. So I'm going to go ahead and turn it over to him to say hello, and I will grant everyone access to the Google Doc. Just give me 1 second.
Thanks, Brenda.
Yeah.
Can you hear me well?
We can.
Yeah. Yeah, this is a pretty informal discussion. I would invite everyone to just shoot ideas, questions, so ideas for discussion, topics for developing a discussion, any specific questions, any specific concerns around FHIR or more broadly standardization. To drive a bit that, or to position the discussions that the kind of discussions that we could have, not as a boundary, but just as a first idea. Just to recap what we have been discussing on FHIR, we had a few sessions, a few webinars where we discussed the basics of FHIR. So FHIR with resources as the atomic unit for exchange. We discussed how FHIR has data elements and how those data elements have data types. We discussed a bit of those basics, not as a formal FHIR, let's say, training, but more as an introduction and welcome to the community. Then we had a bit more on profiling FHIR. So how can we make FHIR fit our specific needs in one specific project? We then had another session on terminologies, which is kind of a good thing, or one of the greatest things about FHIR is how it handles terminologies. And then we had another session on putting that all together and making implementation guides. So in all of those, these were 2-hour sessions, and we had some, of course, some shortcuts, so some quick ways of doing the things that normally there's a big theory behind it. We made some kind of shortcuts in the sense that this is how we work. If you want to understand how this all works in the background, there's a lot to be said there. So we just exposed the basics, and we left the investigation that someone might want to do for each own, for everyone, or for discussing with the groups like this one, or on chat.fhir.org. Yeah, and at this moment we are at the point that with those sessions we have shared the basics of how we take FHIR as a standard and how do we make it work for ourselves. How do we constrain? How do we use terminologies? How do we set up an implementation guide for our specific project? And we also mentioned some things about what's some more tactical ideas on how to make this work. So the tooling is there. We can use the tooling in different ways. In the last session, we shared some ideas on how this could be put in a process. So if you are in a big company or a small company, or if you're in a country and if you have a project to do some standardization, one thing is jumping right ahead into the tools. The other thing is to make sure that this is reproducible or a repeatable process. You might want to have some standardization approach or some strategy behind it, and we also introduced a bit of there, and we could also discuss that. So it's up to the group what kind of things we are discussing. So we have fireside chat. I'm going to pick my drink, my cognac. Sorry, it's water. But I'm open to questions from anyone. Any ideas, or if there's no questions, we can ask what people are doing, what is their current experience with FHIR, and what is their plan, what are their plans, what are the current needs that they feel, what people want to discuss about FHIR. Feel free to share ideas. Any ideas?
Hello, hi, how are you? This is Sam from FHIR. I have a question about the main challenge that we have with FHIR, that it doesn't have a fixed reference model. And I've seen a lot of people talking about solutions or other proposals, like, for example, OpenAir, which could be covering this area. So how do you see the future of collaboration between FHIR as a standard of communication and OpenAir as a reference model?
Okay, that's a question for a FHIR chat, and I'm glad I have my cognac with me. So let's start by parts. The absence of a I like the question from Beatrice, decision support. I will address that, Beatrice. That's something that we are working quite intensely in. But the question on the lack or the absence of a reference model. So FHIR took much of the experience that is present in the HL7 reference information model. So the data structures are there. That was quite complicated, as those of you who have used HL7 version 3 have experienced. There is kind of a underlying model that was inspiration for FHIR, for not having to rediscuss the whole thing all over again. But indeed, there is no formal model behind FHIR. In a few things, FHIR does have some models. Let me just share my screen, and I will go to the OpenAir topic in a second. So I'll bridge those two. But let me just share one thing. The thing I wanted to share is the models, the current models that we have in FHIR. I will share what we do have at this moment. So that was kind of a conscious decision that FHIR was not going to make a big model up front and then start to implement, because that was the lesson from the past, from the version 3 and from the RIM. The FHIR community decided to just go ahead and say, okay, we know that information enough. It's kind of in the back of the heads of most of the people that are collaborating. So we just go and make something that actually works on practice, not something that is a further refinement of a model until you have 10 layers of that refinement, that then it finally works. I'm not by this criticizing the old approach, or even definitely not the OpenAir. But it's just that FHIR found itself in the solution, like, if we go down the version 3 path again, we will have this thing ready in a long time. And the idea was to have the something out there, because FHIR is more of is also trying to include the implementers as part of this. So FHIR wanted to have something implementable out there, so that we can say, okay, we want feedback from the modelers, but we also want feedback from the industry and from the people that are participating in actually doing things. I presume that you can see my screen. Can you see the HL7 FHIR website?
Yep.
Okay. So in the current FHIR build, so in the next release that's coming, we have a thing called patterns. This is one obvious, or when we notice some obvious needs. So when FHIR saw that there was different ways of solving the same problem, and we felt the pain, really felt the pain of not having an underlying information model. For those cases, the community said, okay, we will do something on this. We'll have some patterns that dictate how the information model should kind of look like. It's not a mandatory model, but we have a few things. For example, we have the event and the request. I'm just going to pick those two. So whenever you have a request in FHIR, it kind of follows this model. There is always the identifier for the event. So this could be a prescription or a device request or a service request. There is always, or there could be always, or there should be, according to the pattern, based on which is if this request is instantiating or is based on, sorry, this is instantiating. The based on is if this request is derived from another request that already existed, like if I'm doing this injection because of a broader treatment request, then I do, or if I'm doing this injection of contrast because of an imaging procedure request, then this follows the same pattern. The same thing that if I'm doing this according to the protocol, then we can point to the protocol in the instantiates element there. And we have the codes, we have the subject, we have the encounter. So these are patterns. So this is not a FHIR resource. This is what we call a logical model. For those of you who were in the implementation guide session, you've seen one logical model. So FHIR has done this in this way. We launched the resources. There's a very basic underlying structure, but the more refined patterns, they appear as the community grows to a level that we say we need some patterns. Now, to look at the OpenAIRE collaboration, there is a difference, of course, in these approaches. This is my personal view. Nothing that I'm saying here is binding the FHIR community or is the broad any broad consensus. I'm just reporting what I've seen in HL7 meetings. I recall one meeting that we had. One prominent collaborator of OpenAIRE, and there was quite of a positive discussion. So there was some discrepancies for some inconsistencies in FHIR, which are due to the approach that FHIR took. So if we have two people doing the same thing, maybe they will arrive at the same model, but maybe not. So there was some discrepancies. So there was a good analysis on that, and overall there was a feeling that it would be interesting to continue those discussions. So this was, I think, 2 years ago. My feeling was that this is interesting. There's still points to discuss. There's still things that could be more close. There is, of course, some difference. But yeah, what we have in FHIR, which was the speed of implementability, we did not have. We would not have if we follow the OpenAIRE foundation approach, that we have the whole foundational model and then we implement. But I think as the discussions go, and I would like those discussions to have more contact points. There are quite some people that are doing FHIR, and they are doing also the clinical modeling on the archetypes in OpenAIRE. I expect more results will come from more collaboration. I don't think there's a split, but it's kind of parallel path at this moment. But yeah, those are different models. There is a difference in models. There are things that we are suffering in FHIR from not having a model, and then we fix the problem. We don't fix the problem up front, thinking that it might be an impact. And this will be seen. Let me just plug into the question that Beatrice asked. So first of all, did I answer okay the question, or you want to have more discussion on this?
Thank you very much. Thank you very much. So the adequate answer.
Thanks. So just plugging into what Beatrice was asking. Hi, Beatrice. One of the things that is noticeable, of course, is that, and some of us are pushing for that, is that if you don't have patterns, if you don't have consistency, then your analytics and your decision support will be much harder, because you don't know whether the information that comes from different places, if that follows the same consistent approach. We are taking care of that, and as FHIR implementations evolve more and more into not just topic specific, so it's not just about the medication, it's not just about the devices, but it's actually, for example, we have supply chain that messes with medication and devices and nutrition products and everything else. And we have those topics that are making us reach to each other, to the different groups, and trying to come up with with some consistency between the models. But there are of course some challenges in this approach, and we are seeing them. But the approach is always iterate the standard and make it better and better. So there are problems, there are challenges. I don't think it's something that's going to be disruptive for FHIR, but I would be seeing with good eyes I'd say the more collaboration, further collaboration, in the sense of, oh, you know what you have there, you might have this problem, we had this problem before, why don't we see if we can converge on the model, etc. We are doing that within the FHIR community, and all the voices that can help in that would be interesting, I think. Again, this is my opinion. So Beatrice, decision support. There's a couple of things that we do in FHIR for decision support. Noticing that caveat, so the fact that data is, by the nature of, we do this not for capturing the data. Oh, sorry, that also for Osama, that there's not, the purpose of FHIR is not to keep the information in a system. FHIR is devoted to the interfaces, so to the interfaces between systems. So FHIR was not dedicated to how to store the data in a database. Of course, it influences hugely how you exchange the data versus how you store the data. But because of that, we have, so having this sometimes variation in the models. Decision support comes in several flavors. First of all, there is one thing that I would start with, that there is a thing called subscription. So it's a new thing that's coming in a new version of FHIR, the release 4B, and it's going to be more mature in the release 5, where we have what we called before the CDS hooks, where basically you have a FHIR server and you say, okay, I want to pay attention to every time that a patient has this medication within 1 month of taking the same medication before, while admitted into the hospital for this condition. So you can put these triggers together. And if you have these triggers, you can start monitoring the system without specifically search. So you have these hooks that you put on this, or for example, if you say, I want, when a patient is on this medication, if the kidney function is starting to behave like that, I want to have an alert so that someone can take a decision. You have that kind of decision support in FHIR. The other thing that you have is the support for measures. So actually we have a FHIR resource called measure and measure report. I'm just going to show how it looks like. Yeah. So measure, basically, for those of you who are doing BI, measure is, BI and analytics, measure is the definition of what data you want to extract. So you say, I want to extract the data for patients with this condition, sliced by gender and ordered by this, and excluding this and including that. These are the indicators. There's many indicators out there for quality of care, for population health. Lots of indicators are out there. So measure is the way to capture those in a FHIR way, in a way that they can then be processed by the FHIR servers. And then out of this, we have a thing called measure report. So you have a measure, and every month you produce a measure report out of that measure. You go to the server and you see that this month you have 10 more patients with that condition, 10 less patients. So actually, as a silly example, or as a common example nowadays, sadly, the measure report would say the people that died from COVID is the people that died with COVID with no associated disease, except, I don't know, what would be the criteria. And that you want fixed, because that you want consistency. You don't want to measure differently every month. Ideally, you should not even measure differently between countries, but that's the reality. But each country, let's say each country has their own measure definitions for those indicators. And then you can tell the server, okay, this month, what is the result of that measure? And then you have the report. And this is done by by means of things like the library. So FHIR has a clinical quality language, for which there's a resource called the library. And I think the best way to look at this, is looking at the resources. So the technical part of this is looking at the resources by clinical decision support. So we have the detected issue, something that happened. We have most likely the library, the evidence report, the risk assessment, and somewhere we have measure in another group. Measure, yeah, so inequality information. So we have some resources for that. We have some people experimenting with that. I think the biggest challenge or the biggest approach now, or sorry, the biggest effort now in FHIR is people doing two things. One, the ones I mentioned. So one is subscriptions. Again, from my perspective, from what I see, subscriptions, and the other one is measures and measure reports out of existing data. How does the data get there? Then in the normal way. So I don't know, Beatrice, if this is a good introduction to the to your question, to what you were meant to ask.
It was great, José. Thank you so much. Congrats on the great work. And perhaps you could mention a little bit more about the different types of architectures that I can use to maybe plug a smart on FHIR or CDS hooks, or what are you using? What do you recommend? Thank you.
Okay, thank you, Beatrice. That gives me an idea. So one of the things that I don't have it at hand. I'll try to search for it while we do this. There is a couple of presentations from HL7 and some of them are indeed about architecture. I don't know if I have this. I might have to get back to this topic. So there is, let me see if I have. So there is quite a lot of information about possible architectures. Let me see if I have it on Google. I know I was there before. Oh, actually, sorry, I should have mentioned this. There are some introductions by OpenHIE and by other people, and I was looking. Architecture-wise, so there, and by architectures we have all these things, and we also have the notion of, do we want central systems, federated systems, distributed systems, all of those things. There are some discussions, there are some working groups working on this, or some countries are working on different things. IHE has published some materials on access to documents in distributed architecture. Let me see if I have. I was trying to find it. Sorry, you caught me unprepared. Oh, wait, maybe not. Maybe not. I'll share this link. So all the presentations that HL7 has, they are public, and we have lots of tutorials. Everything that HL7 has done, it's in this GitHub repository. So I will actually put this on the chat. And if you want, just go there and search the topic. So if you are more in, for example, I'm just noticing this. If you are looking at into ontologies, you might have some relevant information there. If you're looking at, let's say, recent webinars on, well, this is not on architectures, but I think I remember in 2019 we had something on architectures. And no, this is on profiling. 19. Sorry, just to show one to see if I get it right. But the idea is that it should be, this is terminologies. Sorry, let me see if I find it here, but architecture. Actually, it's called FHIR for Architects, I think. So there are some presentations. So this is one of the sources of information that you can have. You have some, yeah. This one, and from Lloyd, so it's good. This is 2018 then. There are some presentations there. Everything that we do is publicly available, we as the FHIR community. The other thing that we have, and you might want to check it, is the Dev Days videos. So there is always I think there's a channel on YouTube. There's a video archive on Dev Days. I'll just put it here. And the Dev Days is a nice event if you want to join. You can have the, if you join, you have lots of sessions with from beginner level, where you say, okay, where you discuss basic things, how to get started, until more advanced technological things like how to configure the Happy server to do this and to do that. I don't know any of that because I did not join those sessions, sadly. And you have other sessions, which is how should the future of FHIR be, etc. So there's, or security, or some technologies like Python versus Java, all those things, terminologies. We have lots of those. And I think so if you look at this archive of videos, you should be able to get this. For example, Graham has this definition of GraphQL and graph definition. For those of you who are interested in really the analytics part of this and not having FHIR resources, but doing cascaded searches with the GraphQL, so this is where I would start learning myself. I know a bit about GraphQL, but if I want to learn more, I will do this. Same things like if you want to do things on, for example, security, there's always something there. If you want to learn specific tools, there's lots of videos there. Yeah, if you want to build a FHIR facade out with the Vonk server, that's it. If you want to learn how to do search, that's it. So there's quite some videos, and videos are, I think videos are a good way to get the information at a good pace. Personally, when I read things, I skip the things that I should not skip, and sometimes I have to read twice, and I miss a bit the topic. So I think a verbal presentation, for me, it's personally helpful. So you have those kinds of resources. And about architecture, there are videos about FHIR architecture. In any case, I think there's also stuff on YouTube. So just check. Right, you might have something there. Yeah, so this one should be interesting. It pretty much goes into the direction of how do you want to distribute your data? Do you want to centralize data? Do you want to have your data, your FHIR interfaces on top of an existing server? Do you want to reuse that server, or do you want to have a completely new repository for FHIR data, and all the challenges that come with it, and how FHIR operates with that? You will have a good start there. For those of you who are not in the other sessions, this is the starting point. So these videos, they are the starting point. The second step is you learn by doing, and you learn by chatting with the others, by asking in chat.fhir.org, and we all the fun discussions are there. I hope this is helpful, Beatrice.
Yes, wonderful. Thank you so much for sharing all those.
Sorry for just dumping the information, but we cannot go into the details of each.
No, I understand. Thank you. Thank you so much.
So there's another question from Ed. What options are there for server to handle messages? I'm familiar with Happy. No, Happy has not established itself as the official and unofficial reference technology. So I can tell you that I started with the Pascal server, so the one that Graham was building, because I was more in the Pascal world, because last time I did programming was so long ago that it was still Pascal. So it is a matter of preference what you want to do. The most actively maintained servers at this moment, I think they are still Vonk and Happy, so the most disseminated ones. There's advantages and disadvantages to having open source versus a professionally maintained service. You also have professionally maintained service. So without going into that, there's a lot of servers, and I have a link that should help in that research. So sorry, by the way, I don't by doing Google search, I'm not meaning that this is as simple as a Google search, or it's just because I have in my head the keywords that I remember seeing. I don't know where they are, so I'll just, yeah, this one, publicly available servers for testing, and you have this on the wiki, which means it will be redirected to something else on Confluence. Right, that's it. So there are publicly available implementations of FHIR, and you have quite a few of the implementations there. And let me see if we have this. open source implementations here. So just in case, I'll just put those two links over there. So these are servers that actually exist, and these are open source implementations. So servers that you can use yourself. So there's Java, .NET, I don't know the difference between those two, sorry. And the Smart on FHIR is just an add-on. Delphi, that's the one I mentioned. That's the Firecracker, the Ruby, there's a Python implementation. There's quite a few implementations. This is not just servers, these are also clients. So you have to navigate a bit here, but you have the implementations that are known, and this is an open page, the owners of the tools, and everyone can just build up this page. So if you have these two things, you should be able to get started. If you have any questions, just go to chat.fhir.org and ask around, and it will be you'll be well guided. But yeah, Happy is the one that is fully open source, but also has some professional support. So I think that counted a bit, not having professional support, but I think the fact that it was fully open source, it helped, and it was in Java because Graham server is also also fully open source, but not many people are doing Delphi programming nowadays. A word so it's just an idea to the people in Brazil, Beatriz. I know that Brazil has a very good Delphi community, so it will be good if people join in, and if they say, "Here's, I want to have my own server," because I was familiar with Delphi as well. I did some changes to the server in the sense that I wanted to have my own local server without having to download anything or even on Docker. I just wanted to have a zip file that I can just put on a pen drive, and I double click and I have a FHIR server. I wanted that, so I made that. It's accessible for demonstrations. That was my purpose. If some people want to use that for terminology server, that also works. Actually the FHIR reference servers for terminology, they are based on the Delphi server. So I think that Brazil has a good step, a good opportunity there to launch FHIR by relying on the implementation that exists on Delphi, if you want. Otherwise, if people are migrating to Java, you have the Java. People are using .NET. You also have some tools there. People are doing Python. There are also tools on Python, etc., etc. It's choose your flavor and stick with it, or choose another flavor if you're not happy with it. Any other topics? Did what I just say so far trigger any? Oh, genomics. Thank you for this question, Sama. I would answer in the way that I should answer this question, which is I have no idea. Apologies for not knowing. I could not. I mean, I'm not the question, so I could not prepare. What I would say in that is, I hope you have an account in chat.fhir.org. So I will just go to chat.fhir.org and I will do this. There should be a group for genomics. And I don't know if there's even a stream for genomics. Let me see if there's anyone really dedicated to just discussing the genomics part. Yeah, so there's cancer genomics. I don't know if this is the only thing that we have on genomics. Let me see if I have if we have any stream for genomics. Yeah, there is a stream for genomics. So I just subscribe to it. And then we can see what people are discussing there. I don't know if there's any. Yeah, there is some discussion. So this is what I would do. I have no idea what's happening on genomics. So the best thing, go to chat.fhir.org, see if there's a topic, search for the topic, search for the stream, and just jump into those discussions. Okay, Osama, I think that gives you, that answer is sufficient for you, and I hope it is sufficient for you because I don't have any other answer. So Kasim, thank you for the question. FHIR Mobile. A couple of things there. In this open source implementations, there's one thing that I just noticed that it's already there, the Flutter. So and there's other implementations. So there is, when we talk about FHIR on mobile, normally you are doing one of two things, which is entering data on a mobile platform, like I want to register that I took medication, or I want to just fill in some data and then submit it to my hospital, like how am I feeling today? The first part, like I took my medication. This is normally a dedicated app. And the fact that FHIR works on REST services, then FHIR is just the exchange. So there are libraries for Android for FHIR. In terms of the functionality, it doesn't matter because FHIR is all about the exchange of data. But that question reminds me of Flutter and other implementations that we have a thing, quite a nice thing called questionnaires in FHIR, which is a way that you want to capture data in a structured way, but without that structure being questionnaires. By the way, this is one of the things that I remember seeing a joke on Twitter a few weeks ago that people were saying, well, if you don't have a problem with FHIR, just put a questionnaire in between and that's it. So FHIR is a structured way of exchanging data, but it's not really structured. It's like an ad hoc model. But if, for example, for registering how you feel today, or registering your conditions for having an MRI exam, or your conditions for donating blood, these things that are typically requiring someone to enter data in a structured format, like a web form, FHIR has actually a mechanism for that, the questionnaires, and we have developed quite some tools to be able to develop develop front ends based on that. I just wanted to show you something. Let me just share with you something that we had. Again, it's just an example. Don't mind the content. It's not about the content at all. It's just about the example. If we have, oops, go here. If we have a FHIR implementation guide, so if we have our specifications, and if we have in that specification, if we have a questionnaire, like in this case, this is a questionnaire. So this is a FHIR questionnaire. It says, if you want to report a case of HIV, or when the nurse is registering the data about the patient, they will ask a few questions: the patient identification, the gender, etc. And the last time they did the CD4 counts and the viral load tests, all those things. These are the questions that they might ask. This looks okay as a model, but the FHIR ecosystem is really promoting initiatives that want to bring this even closer to a DevOps or to a ready-to-build application. I'm just going to share one example. This is just one library that renders the questionnaire in a way that you could display it in a mobile application. And there's more of that. The Flutter is the other library. So there's several libraries that you say, I have a FHIR resource, and I just want to use that to automatically generate my mobile app. You can do that. I mean, to certain limits, of course. This doesn't have login. The server needs to be prepared for that, etc. But there are a few things that are being done. So to Kasim's question, FHIR Mobile, there is an Android SDK. There are a couple of things happening on the Android world. You should check the open source implementations, and specifically on Exchange, FHIR is just a RESTful format. So what you care about is having a library like the Android SDK or something that handles the FHIR objects. The rest is just normal web interfaces. And specifically for the case of questionnaire, you might also have some tools that help you on the front end. I hope that is okay. If not, just let us know on the chat while I move to the question. Thank you, Kasim. The other question from Osama: cross-countries exchange based on IPS. Is this the question, whether it can be done, or whether if it's being done, or whether how do we go from there? I don't understand what is the scope of the question, Osama. Can you clarify, please? Okay, no, the IPS has been developed as an international standard, and it is supposed to work across borders. So it is designed to be not specific to one country or on another country. It is, I don't know in which release it is, but it's already been out there for quite some time. So it's a good time to validate it and to see how it works, with just the caveat that it is a summary. So it just provides a summary. It doesn't provide the entire patient record. It has some ways that it can always be expanded to provide more and more information. But if you want to do it, just look at the IPS implementation guide. URL for that, but I can just, well, there it is. You have this, you have the specifications, and you have the, let's start with this, the FHIR artifacts. So you have the implementation guide there, and from this you can have the links to all the other so data types and to all of the IPS composition, which is another profile, and the medication statement, which is another IPS profile, and the allergy intolerance profile. So these are all profiles that put together, they are used to create a patient summary. None of this is country specific, and I think, I don't know if they use SNOMED here, because SNOMED has the normal so SNOMED has the restrictions that some countries might not be adopting SNOMED. So I see LOINC there, I don't see SNOMED, which is okay, but you can always add your own value sets. So I don't know if you have any more questions on the cross-country exchange. I just know that it is supposed to be cross-country. It is being used in several pilot projects, to my knowledge, about trying it out and seeing how it works, or how it resolves the problems on the field. Yeah, I would say just start looking at this, and I think there's also a stream or some discussion on Zulip on IPS. As you see, my go-to when I don't have more depth of knowledge, I just go to chat. I don't know if there's something on IPS. So yeah, while I wait for the next question, I'll just. Right. Okay. There is a question. There's a stream on IPS, and I was actually subscribed to it. So yep, the same old. You just go there and you see who's doing this and who is adopting this. And if you don't know who's adopting it, you can still ask there. You have the calls and the profile, the technical questions on the profiles. If you have specific meetings, if you want to start doing something, the best thing is to say, hey guys, we want to start experimenting this with 2 countries. Does anyone have any advice? And then most likely people will respond quite quickly to say, well, in which country are you doing this? We might have a contact here, or we might have done something on another country that might use the same language as you are doing, etc., etc. So Sama, I hope that is satisfying your question. Any other topics? Any other questions? Any other ideas? It's a free discussion. There's no predominant topic. So shoot anything. If not, and while not, I would just mention a couple of things, just because I was thinking of this before the session. As we discussed briefly in the implementation guide session, it really helps that you have not just the technical FHIR knowledge, but more importantly, I think, is a standardized way of, or standardized approach to things. So if you want to resolve the problem, one specific problem of interoperability, you just make a profile and you make an implementation guide and you're done. But to make it sustainable, not only to make it sustainable to have more and more projects at the same time without having lots of overlap and lots of conflicts, which will happen if you don't have a proper strategy. I mean, they will happen anyway, but it will happen more if you don't have a strategy. But also, when you start a project or when you start a FHIR profile, the expectation is that it's going to be there for some years, for several years, and it will be maintained. And it will have to be updated when FHIR updates. Then you might want to update it to the latest version of FHIR, or you might find new requirements, and you have to put the new requirements onto your profiles, onto your implementation guides. So you might consider setting up a process. We will be sharing some ideas on this in these sessions, or in the website that we have for these events. Maybe we should put some some cool things to know, pinboard or so. But the key point that I wanted to transmit is, It seems to work okay if you adopt kind of the V model, but if you really adopt it in a structured, in a FHIR manner, as follows. You have your information, your requirements. Everyone has requirements. You can have 2 sentences of requirements or 200 pages of requirements. That's how the field is. You should try to capture, first of all, what information do we want to convey, and you have the logical data models in FHIR for that. You can do that in FHIR, and then from the moment that you freeze that, you say, okay, this is information that we got from the clinicians. From now on, it's just a technical matter. It's just a matter of choosing the right terminologies. Okay, terminology is not really just a technical matter, but it's choosing the right profiles, the right data types. Those are things that you do technically. As long as you stay within the boundaries of what is defined, you are fine, and you don't have to rediscuss the technical details with non-technical people. Then you make those profiles, you define your terminologies if they are not defined for you. So as a technical implementer, if someone says you have to use LOINC, then you have to use LOINC. If someone says you can use any codes for this, then you use any codes. You can define your own value sets. Then you implement this, you keep it in implementation guide, you keep the versions, the version tracking there. So it's good to keep everything in version control. And then you have we are doing some experimentation on testing. So how do you test this? Do you test the whole thing, or do you test by blocks? Which blocks do you test? Do you test the read and write applications? So the read and write operations at the same time, or do you test differently? In that sense, IHE has a model that I think works quite well, which is we group the functionalities in actors and transactions. So each actor has to have some transactions. And then when it comes to testing, you are not testing the whole thing for every system, because systems might have different functionalities. But for example, for a prescribing system, you have certain functionalities that the dispensing system doesn't have. They use the same resources, but the prescribing system has some functionalities and the dispensing system has different functionalities, even if in the core, they will exchange the same types of resources. So it helps follow the path of defining your information models first, seeing what you want, then seeing what is out there. Very important. Look out for FHIR implementation guides. So there's another thing that it might be useful to share, the FHIR IG registry. So you might want to check this out. It's also, so if I'm going to make an IG registry, let's say I'm going to do something on COVID. Let's see if someone has already published something on COVID. Well, there's a COVID certificate from Taiwan here. Okay, good. Then I can see how this works. Oops, I don't see how this works. There's an error. And actually, I do remember there was a maybe actually this is the. So this seems like a happy server in the back. Yeah. And this is the happy server, and this is the capability center. So actually, this is not the pointer to the implementation guide. It's actually the pointer to the server. So if I do this, I should have the front end of happy. Let's see if it works. It seems to do something. But yeah, so you have a registry of implementation guides. So whatever is the topic, first thing, go and search what is there after you make your requirements kind of clear. Document your data needs, and this is the point that you might want to check. Let's see what OpenAIRE has in terms of models, to see if the models make sense, or if the combination of models makes sense. Then you do this in FHIR, then you implement it, and then you test. But if you have that approach, if you have a structured approach to say, I will always make my logical models, I will always keep my terminology requirements visible. If you do that, next time you have to visit this because you have a maintenance to do, or you have a change, or FHIR has changed, or you want to add to your scope, it makes life a lot simpler. And as you see, so this is just one example of a FHIR server. You have lots of ways to search for information. So the FHIR registry is where you search for things that are already published. If you're more into tooling, you have the other resources that I shared. And we spent most of the time talking about how to do FHIR, but it's more and more important or more and more useful now. As people produce more things, it's getting more and more useful to first see what is happening out there, try to relate to that. And I'm guilty of, sometimes I see this and I see a resource and I say, I think we need something better. it can happen. Depends on how you see things. But it really, even if I'm trying to see what are the best solutions, and not just applicable copy paste solutions. Even the copy paste has very good advantages. I've done lots of work by just seeing what is out there. Then it saves discussions, it saves the effort. As long as the requirements are clear and we know if what we are taking meets those requirements or not, we are much better off by providing by relying on what's already out there. And as a consequence, for example, if I'm using the IPS to do some project, and if while doing this, I realize that I think the IPS should have an extension for this or for that, or for, I don't know, I cannot remember anything, but maybe the IPS would need a flag. I'm just making up now. If the IPS would need a flag for certain types of conditions, like psychiatric conditions that we want to keep more secure or more confidential. If that would be the case, not only I'm saving a lot of work by using the existing IPS, but also if I have that idea, I have the opportunity to go back to the IPS group and say, hey guys, has anyone done anything on this kind of classification of sections of the IPS? And if people don't have it, they might think, well, that's a good idea. How did you do it? Okay, we can onboard those changes into the IPS itself. And then it becomes a collaborative effort. And I'm really a strong believer in that part. It's not just because we ask and we share. It's by sharing, we might have ideas and we give back those ideas to the community. And the community is always happy to receive those ideas. So whatever you are doing, if you rely on the others, I'm pretty sure that the others will also want to rely on you. You're asking, does internet URL have any relevance to FHIR? If it does, it is universal acceptance, non-letter character compliant. Benjamin, I cannot answer that question. I do not know the basics of the. So I suppose that you're asking about the fact that now the URLs have non-ASCII characters. They have all sorts of characters. You can put all sorts of characters. I don't know if that affects, or if there's any provision in FHIR for that. I haven't seen any discussion on that, so I don't know. Yeah, I don't know if there is any impact, but this might be an interesting question to ask in the chat.fhir.org and say, hey guys, has anyone seen any impact of those of the non-Latin characters in the specification? Do we expect any issue? Let me see if this. So there's this RFC that. No, that's not it. This is the percent encoding. Or maybe it is, I don't know. So I think we would have to, so I will just put this thing here, Benjamin, maybe it helps you get there. And the kind of advanced questions that I would expect from someone that's really in the weeds on this, I would expect to be looking at this and saying, this is, I've checked the specification like this, like we are seeing here. I've checked the RFC and I still have a question. Do we want to support, or do we support or not non-Latin characters? How does this work? Does anyone expect this to be an issue because we have to encode some characters, but we have to encode them all? I don't know what consequences could there be. But if you look at the specification, if you read it and then you say, okay, I read it and I have a question, that's very well appreciated by the community. So feel free to provide your feedback. So we have 4 minutes left. Sorry? Okay, we have 4 minutes left. I don't know if we have any more, any last topics to discuss. If not, I would say I would hand over to Veranda to close the session, if you don't mind, Veranda. And I will thank you. This was actually a very participative and very interesting question. I hope that I will keep track of the links that I shared those, because it's kind of it's 5 or 6 basic links that we want to have on your bookmarks. Of course, I don't have this on my bookmarks. I have it in my head, the Google strings. But it might be good for you to keep an eye on those. And after you see those 3 or 4 times, you will know where to find them. But I think, or Google will know where you usually find them. But I think but I thank you for the questions. Those are quite interesting questions. Again, I could not answer all the details, but I invite you to go into the chat for those things that were not answered, and go to the repositories. You have, as you've seen, you have a lot of information out there, and a lot of people willing to discuss with you on whatever matters. From my part, thank you very much, and see you soon. Fronda, over to you.
Yeah. All right. I will just echo Jose. Thank you everyone for participating, asking your questions, coming, and helping us have this really engaging conversation. We have an upcoming FHIR webinar on September 1st, where we'll be talking to Gembi Systems. They're going to walk us through their experience on implementing FHIR with OpenHIM. So look out for the registration link. It should be coming next week, and I'll include it in the email I send with the recording of this webinar. And we've got other FHIR webinars coming up once a month, as well as Fireside Chats once a month. So thank you all for coming. Appreciate it, and have a lovely day.
Thank you, and enjoy your weekend.